So, welcome, guys, to another episode. I'm really excited today. We've got a special guest, Ed Calvert, who's going to be joining us today. And we're really going to get into the world of dental monitoring and being able to really track your patients remotely. And we're going to get into the details of how that all works, the benefits, and how you could potentially add that into your practice as well. So no, thank you, Ed, for agreeing to be with us today.
No problem. Thanks for having me on, Arnold. It's always I always appreciate the opportunity to talk about dental monitoring. Quite passionate about it. Bit biased because I work for the company, but yeah, it'd be good to have a discussion with you today and sort of maybe increase the awareness on some things that you may or may not be aware of with regards to the monitoring.
All right, so it would be great to just start with, how did you get into dentistry as an industry? How does that even work?
Yeah, good question. I go right back. I actually did physiotherapy at university, so very unrelated. But my brother is a doctor, and he is a gastroenterologist actually in Exeter now. But he had suggested that he thought my personality fit. I like sort of medical, the side of things, but also the sales side of things, the conversations. He felt that I might be quite a good fit for that. So I spoke to a rep that he was dealing with at the time, just to see what the job entailed, and then I kind of ventured into it that way. So it was more surgical sales initially in the NHS.
Mm.
Moved up to Edinburgh for a job up there. Fast forward a little bit, I ended up getting some sales training off a guy who left Align Technology. So
Mm.
he was quite high up at Align Technology, and I think he's actually maybe gone back to them recently. But he did some sort of more consultative sales training, going into a bit of depth as to trying to find out what people are currently sort of struggling with, their problems, and sort of trying to add value along the way to get them to a better place or to a future goal where they want to get to. Anyway, I didn't know about Align Technology before meeting him, but then kind of did a bit of research and thought, super interesting, a world I didn't really know existed. I didn't have orthodontic treatment myself growing up to NHS or anything like that, but uh, could see that Align Technology, the share price, the growth, everything was huge there. So that caught my attention. And then
Mm.
I got approached maybe 4 years ago about an opportunity with dental monitoring. I hadn't really heard of them, but
Yeah.
I almost got the same vibe as Align. It's a disruptive technology, a startup. It's completely sort of they're creating the market, if you like, at that time, and it got my interest. So I did apply for a job and I didn't get it.
Okay.
So that was the first thing. I didn't get it at the first time round, and then another opportunity came up for a different position, and I went for it again. I felt like I did a bit more research on the company, understood it, and
Yeah.
fortunately was successful. So moved down, but I actually haven't been in dentistry or orthodontics very long at all. So sort of just
Yeah.
under 2 years.
Okay.
As you know, there's a lot to learn. I can't even scratch the surface, and I don't pretend to, with
Mm.
regards to the technicalities of it. However, I'm very much focused on monitoring. So it's we're specialists in monitoring orthodontic treatments, and
Yeah.
it's been a real learning curve. I've sort of thrown myself in. I'm a bit obsessed with it.
Yeah.
My wife's not like overly happy with that aspect because it's evenings, weekends. I'm really trying to dive deep into it, but
Yeah.
passionate about it, and it's a super interesting area for me.
Yeah. So, I mean, at the core of it, what would you say um, you're trying to achieve through dental monitoring? What is like the summarized? What's the aim here?
Yeah. So really simply, we sort of believe that dental monitoring, we're giving you information. So it's information that you wouldn't normally have access to. So
Mm.
what happens? Most practices would see their patients, if it's a fixed brace, maybe probably every 6 or 8 weeks. Aligners
Mm.
varies between when you speak to people that see them every 4 weeks, 6 weeks, 8 weeks, and that in itself is an interesting thing. How do you set your intervals and why? Because everyone's doing it differently. But
Yeah.
essentially, what we are doing in a nutshell is giving you information. Every week, a patient would scan their teeth. So
Hmm.
on a week by week basis, you should have up to date information as to really what's happening with your patient's treatment.
Yeah.
So that's one element. But if you break it down, there's also really three areas we're trying to look at. One is the patient experience,
Hmm.
because again, they're scanning their teeth, but they're getting a lot of reassurance. The practice should be messaging them back, should be answering questions through the app. So that's one element, and there's a lot we can do on that. But then the other thing is practice optimization. So you're a busy clinician, and I don't know how many patients you see a year, but we can certainly help. You mentioned efficiencies earlier on. We can certainly help become a bit more efficient with scheduling.
Yeah.
We can help practices grow. And then also the quality of care is another area that we look at, because we have the data. So we can
Mhm.
see where the attachments are being lost, buttons being lost, the unseats are, what tooth and at what stage oral hygiene is an issue across thousands of patients. But more importantly than that, we can give you your data to look at, and then we can target 3 areas or something like that and say, Arnold, right, this is the areas you've said you want to look at.
Mhm.
Let's say it's oral hygiene or attachments. We're going to focus on that for 3 months, see what the data gives us.
Yeah.
But more importantly, moving forward, we want to do something with that data to improve the quality of care that you're providing.
Yeah.
So it may be, let's say, oral hygiene is a big issue week 6 across your patient cohort. Lots of issues with oral hygiene flagging up with the AI. So what can we do? We can automate a message at week 5 to all your patients saying, we
Mhm.
notice for our patients, typically this is when people relax or they don't just let go of their oral hygiene a bit.
Yeah.
So we want you to make a concentrated effort on improving your brushing. It's an automated message at week 5, but then we can see if that actually has an impact. So we're looking to try and improve the quality of care as well.
So I can actually see that being something that could be useful for outside of ortho, just general dental care. If you wanted to, let's say, even with oral hygiene, it could be something that, maybe patients that are struggling with gum disease and you put them on a regime. This can be used to just track how well they're implementing the instructions to improve their oral health. So I can see it having an impact outside of what you've even talked about there. So
Yeah,
huge potential there.
100%. And I don't know whether you know about this sort of background dental monitoring. It's around about 10 years old, but it's one of
Okay.
the only dental companies that's been valued as a unicorn. So basically, it's
Mm,
got $1 billion valuation. Now, it's just a valuation, but the reason it's been valued highly and is growing quickly is because of exactly what you said there. At the moment, we're focusing on orthodontics, but really, we do look at soft tissue, we do look at gum disease, recession, gingivitis, plaque, and we often get asked by general dentists, where's this going? Because I think in the future it will expand outside of orthodontics,
mhm.
and oral hygiene and preventative care, if you like, is a big focus in the future for the company.
I'd like to know what have been the most beneficial aspects of dental monitoring for clinicians you've been working with. So, I mean, you might get a new car and you barely use any of the features that the car comes with, or you get a new smartphone and there's only a few apps that you use. You get a new smartwatch. You know, you can find out sometimes with technologies that are out there, people have so much capability, but there are only a few things that they'll use that technology for. What do you find the clinicians that you work with, what are they mainly focusing on when it comes to using dental monitoring?
It's a really good question, and you kind of flagged something up. I just got a new phone, and I realised I got all excited about it, and I use basically WhatsApp and Instagram on it. So very good point. I do ask. So one thing I do like to ask the clinicians. So a lot of clinicians that do use dental monitoring, it's quite important to me to understand why. What made them think about changing technology or utilizing it. What problems does it actually solve for them? So I do like to ask this question, because I kind of believe in sales that unless there's a problem you're solving, you're a successful guy, Arnold, you're doing well as you are. Why
Mm,
implement something new? It has to have either solve a problem or have a big enough benefit for you to think this is worth the change.
yeah.
Um, the answers I typically get back are, again, it's that weekly understanding what's happening with your patient's treatment.
Mm,
With aligners, tracking is obviously one of the most important elements that it can pick up. And
yeah.
if I'm being honest, yeah, it's the key thing that they want to know about.
Hmm.
So it's giving them that information. Whereas before, I mean, how often do you see your patient at the moment, and for the quick review?
Yeah. So for myself, it's 8 to 9 weeks
Sure.
interval.
So again, it's that information. So most of your patients, I'm sure, are very compliant. and very good. And you see them at 9 weeks, and they come in for the. How long do you schedule for your quick review?
15 minutes.
15 minutes. So they come in, they drive in, they park up, they come and see you, and if everything's good, great, we'll see you again in 8-9 weeks, or if we need to do IPR. But I don't know, maybe this doesn't happen with you very often, but we know some clinicians, the patient comes in, they say they've been wearing their aligners for 20, 22 hours a day, but they're off track, and they probably haven't been wearing them. And so what is the most valuable part of dental monitoring isn't the fact that actually we can see on the patient card they're being compliant and the AI is telling them to move on every week. That's helpful, but a lot of clinicians say the value really comes from, okay, Ed's gone away, and on week 3, there's significant unseats on 2 of his teeth or whatever it may be, and they're going off track. And if that patient comes to me at week 9 and they've gone off track, and what do we do, refinements or whatever, it's frustrating for the patient, frustrating for the practice, inefficient. So a lot of the people say to us, in a nutshell, that would be, it's the information that we know about, it's keeping them compliant and on track. For aligners, for braces, we're looking at oral hygiene, the brace itself, brackets, whether the arch wire is disengaged. So it's just that information, keeping things on track and being proactive with the treatment, as opposed to being reactive. Every time they step on your chair, it's kind of a surprise.
Yeah, no, that's good. I'm just trying to think about my own experiences, and I find that patients generally tend to fall into 2 camps. There are those patients who will follow your instructions to a T, and they're going to run with it. You're not really going to have any issues of tracking because of lack of compliance. But then there are patients where they'll start off well, and then they'll start to drop off, and their compliance doesn't really recover from that. Thing about my patients, probably something like dental monitoring would be good to catch out those patients who are losing that compliance from aligner fatigue, we like to call it, and have that conversation early to say, for this to work, you need to be wearing the aligners. Otherwise, you're going to be wasting your time, and it's not going to get the result that we wanted. So I can really see a benefit there in terms of those patients who just started off well, but things just start to decline in terms of compliance.
Yeah, and we were doing a training course last week, and it came up in conversations with the aligner fatigue and what practices that use dental monitoring are doing, because they can see it happening in week by week basis. So let's say I'm your patient and I've got that aligner fatigue and I'm being not so compliant, or the tracking is going off. All you have to do is you can get me to come in. You can get me to come in even to the front desk, or don't have to take up your chair time, but to take a scan or to get things back on track. But they have to come into the practice, which probably a bit inconvenient for them. You can say the options are, you can come in here and see us every 4 weeks. That's what you'll have to do if you want to keep on track. Or you can take a 5-minute scan at home every week, and you're not going to have to come in for 10, 12 weeks or whatever it may be. So it's up to you. We do try and there's a few things we try to do to improve compliance with wearing the aligners. Also, the scanning on time is important, because none of this works unless they scan every week.
Yeah. I was going to actually ask that. Someone who's not so compliant at wearing the aligners, how compliant are they at using the scanner as well?
Yeah, it's a good question. So on the average across 30,000 patients roughly in the UK that scan every month, it's roughly about between 10 and 15% that they're late scanning. We know that there are non-compliant patients with or without monitoring. Okay, so that's just accepted. But it's a little bit like Big Brother. It's a little bit like, if I'm going to the hygienist tomorrow, I'm probably going to brush my teeth better than ever. If you say at the beginning, Arnold, to your patients, look, we're going to use dental monitoring. It's almost like CCTV for your teeth. We're going to be able to see your teeth on a weekly basis. One, so if everything is good, we can make it more convenient for you. 2, if anything goes slightly off track, we want you to keep your treatment on track, so we can be proactive and get you back in if we need to. But it's a bit like, it's called the Hawthorne effect. At Big Brother, and typically, if you've got patients that are compliant, they'll be compliant, but it might just bring the compliance up slightly for all your patients. So the non-compliant patients, make them slightly less non-compliant.
Yeah.
It's something we have to work on, but a lot of it comes down to the education at the beginning and the understanding why you're using monitoring and why it's so important to do it every week.
What's the adaptation process like onboarding? Because I can see that being a bit of a put off. I've been doing things a certain way, and all that you're saying about dental monitoring sounds great. Then there's a whole onboarding process and me changing
Yeah,
maybe what I do in my process. What's that been like?
yeah. So it's a good question. So the two main challenges I face are probably getting in front of busy clinicians. Their priorities are opening a new practice, seeing patients, whatever it might be. I'm just a rep trying to get their attention. So my brother,
Mhm.
as I said, he's a doctor. He is the sort of person that would never see me. He doesn't like to see reps. And I'm trying to say to him, look, I might have something that could help your patients, help your life. And he's like, no, just not interested. So
Yeah.
I think I face that on a day-to-day basis, which is fine.
Mhm.
Other challenges change. It's change management. So
Mhm.
any practices that go on board with dental monitoring, you've been working the same way for however long, and we're
Mhm.
telling you to it is a change in scheduling, it's a change of working, and it's 3 to 6 months of potential pain,
Mhm.
I'm being honest. But on the other side of it, it's a different way of working, and a lot of practices would say we would never go back
Yeah.
with the efficiencies. But what we do an online sort of training. If you went ahead, an online training module for your team and yourself,
Mhm.
because the other thing is dental monitoring doesn't work so well if your team aren't on board, the
Yeah.
clinician's not on board, and the patient don't understand it. So there are three parts that need to be there for it to work well.
Mhm.
And so we do online. Then we would come and do some in-person training. How to
Yeah.
put new patients on, how to look at the protocols, and then what we do is we create a WhatsApp group. So we're very quick at getting back to practices that join us with technical questions. We're quite proactive. We look at your dashboards to see if there's anything that could be tweaked, and
Yeah.
it's an ongoing process. But it is a bit of change. It is a bit of change, and I would be lying if I said it's all like a golden pill that you take that solves everything. It has
Yeah.
a really positive effect on the patient experience, the practice scheduling, if you like. There is a little bit of
Yeah.
admin associated with it.
So, what are the different roles that happen within the dental team to make something like dental monitoring work?
Yeah.
So, the clinician, they're going to be analyzing the photos that come through.
Hmm.
Um, are there any other roles for the other staff members?
Yes, it's a good question. So a lot of clinicians as well, because you're busy. I don't know what your admin looks like, Arnold. How much time you have to
Mm,
spend clin checks, admin in general. We don't want this to take up too much of your time. We want this to free up, certainly frees up chair time, but we want it to free up time for you in general. Whether that's to see new patients, to play more golf, do what you want. We say it gives you time, and you can do what you want with that time.
yeah,
But what we normally do is triage things. So let's say I work with you, and I'm one of your team members,
yeah,
TCO, whatever the team member role is. Oh, hello.
yeah.
Um,
Sorry, sorry
Thank
about this.
you.
Yeah,
So what we would do is I would work with you, and you would say, Ed, I only really want to know about the 5 or 10% of clinical things that are important that are going to affect the treatment. Occasionally, you might log in and send a message to the patient, but
mhm,
I will triage. So I'll message because they message through the app.
yeah,
And I'll respond to most messages, and I'll have a workflow system with you. So
yeah,
essentially, you will say, I only really want to know about 5 or 10% of these clinical things that come through. So
yeah,
we triage a lot for you. So some practices, the associate or the clinician deals with all the dashboard,
yes,
but most of the time, a team member helps triage it through. So the more members of staff you can have involved, the better, really. So they all understand it.
yeah,
I wouldn't normally advise that the clinician just takes it on all themselves because it will take a bit more of your time up.
yeah. Okay, so the whole team can really get involved. So that it's not, a lot for the clinicians just to be handling by themselves.
Yes,
Uh,
we try to. We call them dental monitoring champions, coordinators. And last week in Birmingham, we do ongoing training because
yeah,
it's almost a bit of an upskilling. Some of the staff really enjoy it because they see a lot. They're engaging with the patients, and we automate quite a lot. So with dental monitoring, it wouldn't work unless we didn't automate certain messages going out. But The other element is, you mentioned earlier you've got a cohort of patients where they may be a little bit non-compliant and it could help them. But let's
Yeah.
say even those compliant patients you've got, they may have questions throughout the journey that you may or may not know about. And I don't know how they contact you at the moment, but the other element of what we do is we're trying to enhance the patient experience.
Mm.
So we know from doing patient surveys that during orthodontic treatment of any kind, they typically can be quite anxious and they like reassurance. So it's a really nice tool to message them, to reassure them, to answer any questions they have. They don't
Yeah.
WhatsApp in, they don't have to email, they don't have to call. They just normally would message through the app. And these days, most people prefer to message through apps rather than
Yeah.
phone calls. Um, so the other thing is they can see the teeth moving. I don't know how often you get asked, "Are my teeth moving?" As they should, and they can see what they
Mm.
might come into you, and they can show you. They like, look how much my teeth have moved since I last saw you, because they can see the
Yeah.
before and after videos. So there's a little bit on the patient experience side. There's quite a few things we can do on that front. Also, marketing for the practice through the app again. But yes, if the whole team get on board and understand it, it can make a big difference to the way that the whole system.
That's even another point there. The whole thing of, because the patient is seeing the changes, that's going to motivate them even more. Plus, if they're that sort of patient who puts stuff out on social media, there could be a thing where they show other people what their progress has been like with having treatment by your clinic. Does it give the option to, I don't know, download those images and share
Yes,
them
so
as they wish?
yeah, really simply, yes, it does. And we try to put things like Google links to Google reviews or any educational videos. We can sort of sporadically put them through the timeline through the app, automated.
Yeah,
So it might get to the stage towards the end of treatment where it automatically says, "Ed, if you're happy with your treatment here, please share your morph video with your friends and family on Instagram, tag us, leave a Google review." So we can do
yeah,
it. I'm not saying it's going to get you 100 new patients, but it's all it's all building up to awareness,
yeah.
and it's free marketing essentially, or within the
Yeah.
capabilities.
No, that's fantastic. No, that's really good to hear. I was trying to think of the things that may be a negative, a barrier. So onboarding, having to change the way that you work. How about cost? Because I'm thinking that might be a big thing for people. This additional cost of having this system.
Yeah, 100%. And sort of, yeah, I was keen to ask you, Arnold. Are you monitoring your patients before I kind of get into the cost side of things? Are you monitoring your patients yourself, or do you use any? Because I know there is a few different ways of doing it, but what's your sort of process with monitoring?
So I mainly use Invisalign as my clear aligner system, and they've got their own monitoring um, system
Yeah.
that they provide. I've never really tried it before,
Mm,
so to be honest, I'm probably um, not familiar with how the whole monitoring process works in
mm,
terms of the practicalities of it.
mm.
I'm currently, it's those 8-9 week appointments where I'm having to see my patients, and then when I'm doing refinements, I take a new scan.
Mm.
So again, I'm just seeing how things have been progressing from
Yeah.
where we started to where we are.
Hmm.
But no, I'm not using any remote monitoring
Sure. And
device at all.
and I'm curious because it's a perfect opportunity for me to ask a clinician like yourself, who's doing a lot of Invisalign. Um, we've spoken a bit about the benefits, and it's great to sort of address some of the barriers and some potential downsides as well. So I think it's good to be balanced. But what are your sort of? I'm always keen to get the ideas of what your idea is of dental monitoring. Sort of good and
Mm,
bad. Overall sort of summary of what you think
yeah.
about monitoring in general.
Yeah. So I'll give my perspective as somebody who's been an associate.
Mm,
Um, it can feel like it's a mountain
mm,
trying to introduce, something new
mm-hmm.
that the practice owner has to get on board with, and then the staff members have to get on board with. So, you know, it's not just the barrier of getting on board and everything like that, or the cost.
Yeah,
It's now I've got to convince
yeah.
the rest of the team into this. Also, who's going to be covering the cost of the system? Am I taking that on myself as an associate,
Mm.
or am I having to try and convince the practice owner to take this on board and really lead and spearhead the practice?
Yeah.
Taking on something like dental monitoring. So I'd say for somebody like myself who's been an associate,
Mm.
it's thinking about I've got to convince everybody else, and I'm potentially now also paying this um, my out of my pocket as well.
Sure. And no, it's good. It's good to understand. Everyone's got a slightly different situation, but we know associates like that's a very common feedback we get. Is it a split cost? Do we have to take the cost on? Do we have to convince the practice owner? Get the team on board? So we can see already there's some challenges before we even consider like would we go ahead with it. I'm curious on a cost perspective, like what would it have to give you in order for it to be something where you think, okay, I'm interested in this. Is it a upside in terms of profitability? Is it the patient experience? What sort of would get you interested in actually digging a bit deeper?
I mean, for me personally, patient experience is a big thing. So with my patients, um, I like to make sure that they've got like a care package when they start
Mm,
their orthodontic treatment.
mm,
So having something like dental monitoring is also a nice addition in terms of giving them that care package that they can take and really think, wow, you really want me to have a great experience with you. It's also a talking point, when they talk with the other people that they know.
mm,
Um, I think it has to benefit my efficiencies as well. Um, and is it going to change my efficiency with how I'm currently set up? I don't know.
mm,
I think what's actually quite appealing is the fact that the patients are taking their own photos, and that's a shareable thing.
mm.
Um, I love a world where the patients are actually posting that stuff and giving my practice more awareness,
Yeah.
more reach. That would be gold. Uh, Google reviews, getting more referrals through that. That's actually really appealing.
Okay. Lots to sort of think about, making some notes as well. But I will get back to the cost side because I know that's where initially where we went. But if I just delve a little bit deeper, because you're talking, the second point was efficiencies.
Yeah.
So in terms of a cost perspective, one of the more straightforward ways of looking at it with aligners is we can typically see efficiencies and we can kind of break down the costs or the cost benefits with that. So, in terms, you mentioned that you're not sure it would maybe give you efficiencies you need. So,
Mhm.
what are your thoughts at the moment? What does a successful treatment process look like for you in terms of efficiencies?
Yeah. So let's say a typical round of alignment is 20 sets of aligners. It means that I'm fitting the attachments, doing IPR on the fit date on appointment one.
Mm,
I'm reviewing them for 15 minutes at appointment two. That might be at 9 weeks. And then I'm seeing them at the end of round one.
mm,
After they finish their round one of aligners
mm,
at, week 20, let's say.
yeah.
And I'm scanning them at that point, or my nurse is scanning them and I'm getting them into refinements.
Mm,
So if I see my patients every 4 weeks, I see a clear benefit of something like dental monitoring, meaning I can then extend that out
yes.
to 8 weeks. So in that sort of workflow, I'm not sure that I'm going to be able to cut down on my appointments
Mm, yeah.
much more than that.
Yes. And do you so are most of your treatments, so 20 sets of land, are you doing comprehensive as well, or is it mainly sort of what's your average treatment length for?
I'm a comprehensive provider,
Mm,
so we can do up to a year and a half of
mm,
worths of
mm,
treatment.
mhm,
But an average case might be a 20 aligner case. You do
mm,
some refinements, and maybe you get 12 to 15 more aligners.
mm.
Um, so yeah, I say that's probably more the typical case.
Sure. Okay.
20 plus 12.
Yes, no problem. So yeah, it is going to be. I mean, we still think that for almost every practice that uses dental monitoring as it should be, it's one of our ethoses is actually we see the patient when they need to be seen, braces or aligners, and but there's a bit of a misconception sometimes that dental monitoring means you never see the patient and you just give them all the aligners and you never see them. Bit Smile Direct, and we don't like that. We don't work with direct to consumer, and actually
Yeah.
the CEO is very big on we see the patient when they need to be seen. Most
Yeah.
patients, the model wouldn't work if it didn't work this way. Most patients are compliant and you don't have to see them as often in your practice because they're going well.
Mhm.
However, you will have patients that cause you more trouble, they're not as compliant, or they just need a bit more help, a bit more hand holding. What
Yeah.
we suggest is that actually you see those patients more.
Mhm.
So it's seeing those patients more and seeing the other patients like myself if I'm busy with work. I don't want to drive into the practice every 9 weeks for a 15-minute review because you can already see that my compliance is good, it's tracking well. So why am I taking time out of work to go to a practice
Mhm.
or a practice to tell me that everything's going well? Maybe there's a conversation around about rapport. That's maybe something we can talk about. But generally, if things are going well, why am I booking me in for 15 minutes? It's taking me 40 minutes to get to the practice, 10 minutes
Yeah.
to sit down, 15 minutes for a quick review. It actually maybe only takes 5, and then I drive home. So that appointment we suggest on a lot of situations can be taken out of the diary. If
Okay.
you are cutting 2 of those appointments out, which is very feasible,
Mhm.
a longer treatment, 30 minutes out of your diary. If you've got 100 patients or 3,000 minutes, however, a lot across the year, the
Yeah.
more patients you have and the more of those quick reviews you free up, obviously you can see the efficiencies there. But then
Yeah.
again, the other thing is it's those patients that do need more refinements because they're not wearing the aligners as much. So you can check the track.
Mhm.
Should see a reduction. Not always because some patients are very fussy, but we should see a reduction in refinements, emergencies, those sort of things we can deal with through the app. So
Mhm.
yeah, it may not be so apparent, but one of the areas is efficiencies, and then the whole thing is, like you said, patient experience. What can we do with the patient care package? How can we get
Yeah.
patients talking about your practice? How do you differentiate your practice versus the practice down the road? If
Mhm.
you use dental monitoring and they don't, they're offering maybe an element of convenience that your practice isn't. So it's sort of combining them all, but yeah, there is a cost to it. So I'll get to that now. Long-winded. Um,
Yeah.
just
Before you get to
yeah,
that,
go.
is there an opportunity to put your practice branding on the dental monitoring system?
It's a good question. So I don't want to give the wrong answer on this podcast. I feel like the answer
Okay.
is yes, they can do that, but I would just have to confirm. I'm sure that there's a potential to do that. I know that some of I think the DSOs and stuff are doing their own like branding on it.
Yeah.
But yeah, that would be a nice touch. So I'll have to get back to you on that.
That's fine. That's fine.
Yeah. Cost wise, so just really simply, if I say let's say it works out at £200 per patient for a year long treatment and the scan box, which is essentially this scanning box which attaches to all the phones. The reason this is important is that it syncs in with the app and allows them to standardize occlusal scans and good quality scans, so you get good images that you can actually work off.
Mhm.
So there's a charge to that, but let's say it's about £200 a patient.
Mhm.
So most practices swallow the cost. I don't know what you charge for your Invisalign, but I'm just going to just hypothetically say at the moment you charge £4,000.
Mhm.
And we work with any aligner system and any brace, so we're agnostic on the branding side of things. But essentially, what the reason most practices swallow the cost is because let's say for you it frees up 30 minutes or 45 minutes per patient.
Mhm.
If you're seeing a new patient in that time, it pays off itself. Or we know that in the UK, the average cost of running a chair is about £300 an hour,
Mhm.
roughly. So we think if we can save you 45 minutes, it kind of pays for itself. However, if you're not comfortable doing that, some practices would charge £4,100. So half the cost is passed on, half the cost is swallowed. And others would say to the patient, well, at Lancashire Smiles, it's £4,200 for Invisalign, and we include dental monitoring as part of our treatment.
Mhm.
So it kind of pays for the dental monitoring side of it if you think your patients would be happy paying that kind of little bit extra. We know it's a competitive market. As I say, I posted about it. We see all the prices getting driven down and down and down with all the aligner brands.
Mm.
So we're looking at ways to be more efficient. Profit per patient visit is one way of looking at it.
So, in terms of cost, there
Mm,
is it, let's say, £200 per patient.
mm.
Is there like a monthly fee for anything else running the service? Is it just simply a one-off fee per patient that
Yeah.
takes it up?
So we've got it's a little bit complex with the pricing, unfortunately, but essentially we have a fixed flat rate offering where you would say if you're starting me as your patient, you press start monitoring, and it's a fixed, £140, whatever it may be, for me
Mhm.
or my monitoring. Or there's like a monthly subscription option, which is roughly £10 a month. So every time if I scan once in the month or 100 times, it's like £10 back to you for as long as I'm in treatment. As soon as I don't scan, there's no charge to you. So
Mhm.
that's it. There's no sort of hidden other cost. There is a startup cost to get the actual dashboard and the training and everything, which varies depending on how many scan boxes you get at the beginning of your journey, if you like.
Yeah. So was that per month almost for having that patient on, or is it on how many scans they do in that month?
It's just having the patient. So if I'm your patient and you only have me at your practice and I scan in March, normally every week I would scan. I don't know what your
Hmm.
line changes are, but 7-day changes. Whether I
Hmm.
scan once or 4 times in the month, it's £10 back to you. So if I scan
Got you.
that month, there's a charge of about £10 back to you.
Got you. Yeah. No, that makes absolute sense. Okay. So a big thing there is saving on chair time and being able to see other patients, new patients, or even carry out treatments in that time that you free up.
Yeah, so the new patient consults, every practice is different. We did used to talk a lot about capacity, freeing up capacity, but
Hmm.
actually not every practice has an issue with that or has the demand, a waiting list ready to come in. But if you did, it would certainly free up time to do that. The other way of looking at it is, let's say again, you're charging £4,000, and at the moment you see, or the practice sees the patient every 5 weeks or 6 weeks, and they see that patient in the practice 10 times.
Hmm.
What we're suggesting is you could probably see the patient maybe 5 or 6 times as opposed to 10 times,
Yeah.
and that doubles the profit per patient visit because there is a cost associated to a patient being in your chair.
Yeah.
And maybe it's not so obvious, but if you break it down to the cost of running a surgery, or I guess the cost of not having someone else coming into that time, then it gets a bit
Yeah.
more interesting from a financial perspective.
And how long does it usually take in that process from saying, okay, Ed, I want to go ahead, to me, Arnold, being able to use dental monitoring in my practice? What's that time frame usually like?
Pretty quick. So the way it works is there's always teams of three with dental monitoring. So there's myself as like an account executive, and I would work with you if you did want to go ahead. And I would say, well, oh, what does success look like for you? Do you want to
Mhm.
work one less clinical day a month? Do you have a certain amount of patients? We try to work on quantitative success, what it looks like for you, and help you get there.
Yeah.
Then I work with an implementation specialist, and a few of them, most of them are clinical or ex-clinical, like dentists or
Mhm.
practice managers, and they would do the training with you and your team. And
Yeah.
then there's a customer service, a person that does technical things as well. So we would send out some online learning for you, and then we
Yeah.
would book in an in-practice lunch or in-practice training session, which we can normally book within a couple of weeks. We are getting
Mhm.
busy with NHS projects now, so there's a lot of sort of demand on that training. But
Yeah.
essentially, yeah, we could probably get you up and running in a couple of weeks, or certainly under a month. We could get you up and running, getting your first patients on dental monitoring.
All right. I mean, can you share some stories that stood out to you since you started working with dental monitoring, of where you've seen a big impact in some of your clients?
Yes. Well, I feel like there's a couple of interesting ones. So, one, I have two nephews. One is
Mhm.
on dental monitoring, and one is not. And it's interesting to see the different experience they're sharing. And also, one of my colleagues, his wife was getting orthodontic Invisalign in Edinburgh before he started with dental monitoring. And she's a busy woman with kids and was scheduling her appointments around about kids, around about school, work, and had no idea. And unfortunately, I think this is also the case. A lot of patients have no clue that it's even what dental monitoring is, or that it's even an option. But
Yeah.
obviously, when he started working for dental monitoring, she realized that she maybe didn't need to go in every 6 weeks for this 15-minute review. And she was
Mhm.
quite adamant that she wanted to change the way that she was scheduling appointments. So I think there's something interesting in just the patient experience and convenience. Some
Yeah.
patients love to see you every 6 weeks, and we get a lot of clinicians saying the patients want to see us every 6 weeks. They like to see us and speak to us. And I agree that there's a certain amount of patients that do want to do that.
Yeah.
There's also a big section of patients that want to have straight teeth, like to be able to get questions answered quickly and have the convenience of not going in every 6-8 weeks.
Yeah.
So that's one area. But the other area is really nice to see. My favorite are when I speak to clinicians who are initially very hesitant, very
Mhm.
reluctant, maybe have an idea of what dental monitoring is, but slowly but surely they come around to using it, and then they come back and they've said to us, for example, with brace monitoring, never understood why I would do it, can't see the advantage of brace monitoring, and then they say to us, I wish I'd been doing this for years, or they say, I'm using dental monitoring, I would never turn back.
Yeah.
Once you work in this way, I would never work another way. That's kind of powerful for us. And also we get patients that are giving really good feedback about the engagement, and that's quite warming as well, because it is a challenge. My role, as I said, I'm trying to approach people like my brother.
Yeah.
Resistant majority of people are quite, they're earning good money, working in a certain way, getting good clinical outcomes. Why would I meet this annoying guy Ed who's trying to get in touch with me and talk about dental monitoring? I'm quite happy with the way things are.
Yeah.
So it's a challenge in getting in front of people. But when they do get it and when they do implement it and come back and say, yes, it's worked really well, then that kind of makes it all feel worthwhile.
Yeah. No, that's good. That's good to hear. Thanks for sharing that. I mean, if people, have listened to this episode and really want to find out more, what's the best way for them to get in touch with you?
With me, yeah, so I'm sort of dental monitoring Ed on Instagram. I try and post quite a lot. I sometimes wonder whether it's worth the time I'm putting in, but it's interesting how many people like this kind of came around from Instagram. And
Yeah.
there's been quite a few people that have reached out, said, "Oh, I've seen you on Instagram. I've seen some of your posts or whatever." So yeah, dental monitoring Ed is probably the best way to get me. And I say normally we like to start with a lunch and learn to find out what your workflow is like, what you're doing at the moment. If, like you said, you want to increase the patient experience, how are you going about it? Why are you interested in the patient experience and care packages to see if it could be a good fit?
Yeah.
Sometimes we go to practice, the timing is not right, or they just don't. It doesn't fit with their model, and that's fine. But yeah,
Yeah.
we're always keen to sort of see how things are running and if it could be a good fit and useful for them for those practices.
Yeah, I'd say it was probably LinkedIn where we first
Yeah.
connected, and I've always enjoyed reading the posts that you put out on LinkedIn. I might not put a comment or you know, but I do see the articles that you put out. Some really good value there. So I think it's that thing with social media that there are a lot of people that are actually seeing what you put out there,
Mm,
but not everyone is
yeah.
commenting or giving you the indicators that they've registered
100%.
what you put there.
Yeah, I think I did a post about lurkers. I think the name for them is lurkers. And
Yeah,
yeah, I mean, I've done it myself. Maybe I've been following something for a year and I've really not sort of engaged or commented, but I'm interested in
yeah,
what's being said. I'm
yeah.
curious on from your perspective as a clinician.
Mm.
There are a lot of dental companies out there, and I'm always quite naive because I'm just focusing on what I'm doing. But I'm aware that you'll be getting approached and different people trying
Yeah,
to talk about different aligners and whatever it may be. What's your
yeah,
thoughts on the best way to approach a clinician about maybe like a new technology like dental monitoring?
yeah. I think the way you're doing it with content is probably the best way, um, because once we've connected, you're putting content out there, and I'm seeing what you're putting out there. I sort of get an idea of what you're about,
Mm,
and if it's something that I'm ready to really, step into, um, I can message you directly. I think the off put is people that come in the DMs and they're trying to offer you something straight away because these days we're getting even. I'm sure some of these are chatbots
Mm. Yeah.
that are just spamming your inbox, and it becomes a turn off.
Mm.
Whenever somebody takes that approach.
Yeah.
But I think content is the best way, and you'll put down comments on some of my posts,
Mm.
or really say something insightful. So to me, that's probably the best way. I think it was actually a post that you made on Instagram that then reminded, or something you did on Instagram that reminded me. Actually, I've been wanting to
Mm.
get Ed on this podcast, and then I messaged you
Okay.
directly.
Yeah.
So I think content, the way you're doing it is really good. I think cold outreach can be a big put off
Yes.
in this day and age.
Yeah, no, I appreciate that. I think it's always a challenge because we want to speak to people, but it's just how do we get in front of people that maybe don't know? Because a lot of people still don't know dental monitoring, what it is, or even that it
Mm,
exists. Certainly, a lot of patients don't. So we're trying to sort of balance this, getting in front of people, but how do we do it in a way that's sort of not going to annoy people, but
yeah.
still sharp?
Are you the only one in your sort of role where you're
No.
engaging with clinicians?
So there's sort of 4 or 5 of us that would be like account executives, but I'm certainly the one that sort of puts myself out there a bit more on these
Yeah,
platforms. The others would
because
probably,
I would never have had a clue about dental monitoring if there wasn't a
yeah,
dental monitoring Ed online. If someone says dental monitoring, you're the person that comes up in my mind. So
yeah.
I was wondering, are you the only one that,
No, no. I
that
think
actually?
that we need to get more people sort of doing a bit more on it then. But no, I do have colleagues, but they're probably using more sort of conventional approaches and events. And to be honest, I can talk about dental monitoring as much as I want, and I'll get so far. But what really works better is clinicians. So if you speak to Amir, for example, that uses dental monitoring,
Yeah.
he's a lot more credible than I am. He's one of your peers, and you're going to listen to him a lot more than you would listen to me, which is fine, and I totally understand it, and I'll be the same. So we find actually peer-to-peer events, things like that, is people talking to each other about what we have is the most powerful way of spreading the message.
Yeah.
But it's certainly a challenge. And the other thing I was going to ask you just whilst you are on is the cost side. We
Yeah.
we feel kind of across the UK that there's a bit of a tightening. We know the economic situation. Patients, it's still deemed as a bit of a luxury for a lot of people to have
Yeah.
Invisalign or whatever the brand is. Um, are you feeling? Are people feeling the pinch? Would you say is that cost side of dental monitoring? Curious what your thoughts are on the costing elements because we know it can give you efficiencies and things like that, but where would you deem that in terms of is it a barrier that you think about as a clinician or
Yeah. So for me, it would be, I'd have to think about how much do I need to invest in something like dental monitoring, and does that investment justify, or is the ROI justified by the investment I'm having to put in? So that's the lens through which I would look at it by,
Mm,
um, because if I find that the ROI definitely is there, then I can make that work
mm,
within my pricing and how I engage with my patients. Um, I think it's just having the capacity and then seeing that the ROI is there.
mm,
Then it's a no brainer.
mm.
Um, I think for me, like I was saying earlier on, the biggest thing was if you're an associate, you've got to get past convincing the principal and the rest of the team to
Yes.
get on board. But if you're a principal, then yeah, you don't have that barrier.
Yeah, and I think that's a completely fair point. We do have a few associates that have taken it on, but it is so few and far between. Ideally, the practice manager can, sorry, the principal can understand what's in it for the practice, more new patients, reputation, etc. Then that's the best way, typically moving forward.
But no, thank you, Ed, for coming on and sharing your perspective. Sharing about dental monitoring. I highly encourage everyone to add Ed on LinkedIn and Instagram as well. I'll probably say LinkedIn. It's a good one because you really get time to give some good depth into your thoughts, and if you're in the world of orthodontics, Ed's content is quite valuable. So I'd encourage clinicians to add you, and yeah, get into some of those insights. But no, thank you for being on today.
Oh, perfect. No, thanks, Arnold. I really appreciate the chance to chat to you. Obviously, been seeing your content as well, and yeah, thanks for giving me about an hour of time to talk all things dental monitoring. Much appreciated.